Good morning. My name is Linda Freed. I know many of you, but I have the great honor of serving as the Dean of Columbia University's Mailman School of Public Health. And today, a particular honor to welcome you to what I know will be an extraordinary morning. It is rare to see a world transform overnight. Epochal change requires time, often centuries, and the women and men who instigate that change seldom have an opportunity to see the result of their prodigious efforts or to frame the next generations of it. We have among us today several people who can take credit for that kind of change. In a few minutes, we will start by meeting a leader who has altered the lives of millions. By making low-cost antiretroviral medication available, Dr. Yusuf Hamid irrevocably changed the shape of our planet. He saw a world with mounting, escalating HIV rates and gross disparities in access to treatment, and created a path to save millions and millions of lives. In only a few years, Dr. Hamid's actions averted a global catastrophe in a world where HIV was continuing to spread like wildfire. He also inspired and activated new dimensions of public health's shared responsibility to eradicate disparities in health and to move civilization forward with the shared gifts of science, humanity, and social justice. Our program today is called And Access for All. In addition to our very special guest, we have several other people joining us who are equally special, and we will be introducing shortly. And together we'll take a forward look at the future of treatment access with this distinguished group of influential leaders and advocates who have written, promoted, fought, and funded for expanded access to medications to combat HIV and other illnesses. From my vantage point, it is very fitting to welcome our honored guests today to this great school of public health, one of the original schools of public health in the world, committed to the Institute of Medicine definition of health, to bring science to collective action to assure the conditions that make populations healthy. I'm very proud of the work of so many of the people in this audience in this school at the forefront of assuring population health around the world. To introduce one such person who will be moderating our panel, I'm very proud that under the leadership of Wafa El-Sadr and her ICAP program, since 2003, they have been bringing life-saving HIV treatment to the people who need them. Working in more than 20 countries around the world, ICAP has been supporting access to HIV care for more than 2 million people and to HIV treatment with the drugs, Dr. Hamid, that you made possible for more than 1.2 million people. This was accomplished by working hand in hand with the people on the ground to shape the programs in a way that responds to their needs and is consistent with the cultural norms and societal priorities of each region. Through that work, we have been honored ourselves to see the transformation in the lives of individuals, families, and communities in the most severely affected communities, and to see the impact of the actions that you have taken and led. So now, before we begin the program, I'm really delighted to introduce my colleague, a member of the Mailman School's faculty, but the Executive Vice President of Columbia University Medical Center and Dean of the College of Physicians and Surgeons, Dr. Lee Goldman.
Linda, thank you, and let me add my welcome to our distinguished guests and to everyone who's here this morning. It's interesting that if you look at the last several decades of the global HIV response, you see a rather remarkable alliance of people who, in some ways, disagreed on almost everything other than trying to address the HIV challenge. Here in the U.S., we had liberal Democrats and conservative Republicans, people who were on opposing sides of virtually every major social debate about where we're going as a country. But people were able to work together because they saw a greater goal. But as that response grew, led by people like our own Wafa El-Sadr, there was always this one sort of elephant in the room, which is in order to address the HIV epidemic, you needed medications, and the medications were very expensive. And someone had to step up. Someone had to make that seemingly insurmountable challenge a tractable issue. And Dr. Hamid, we are enormously grateful for what you were able to contribute to make that possible. And what we have now is certainly not a cure for the global HIV epidemic, but a feeling that with lots of people from lots of disparate backgrounds, with, as I said, lots of different beliefs about lots of other things, we've made enormous progress. It's been a true team effort, and I'm just delighted to have you here as one of the true cornerstones of that global team effort. So on behalf of everyone here at Columbia University Medical Center, welcome today, and I look forward to a stimulating set of talks, videos, and discussions. Thank you.